Let's be real. Nobody likes going to the emergency room, right? It's stressful. But imagine if that stress was amplified, like 100 times over. For many individuals with autism spectrum disorder, that's exactly what it's like. So, what if we could actually redesign that whole experience? Today, we're going to dig into a guide that shows exactly how to make the ER more manageable, more humane, and honestly, just more effective for everybody involved. Okay, so before we jump into the solutions, let's just paint a picture. Just for a second, think about it. What's the first thing that pops into your head when you imagine an ER? Yeah, it's pretty much a sensory minefield, isn't it? You've got those blaring alarms that never seem to stop, the super bright fluorescent lights that kind of hum and flicker, jam-packed waiting rooms, and who knows how long you're going to be there. Then you add in all the unfamiliar medical stuff and a parade of strangers. I mean, it's a perfect storm for anxiety. All right, now take all of that and imagine someone turned every single dial up to 11. The sounds are louder, the lights are blinding, everything is just more. For someone with sensory hypersensitivity, this isn't just uncomfortable, it's completely overwhelming. It's a total system overload. And that right there, that's the core of the challenge we're talking about. We've really got to understand why the typical ER setup can be such a massive barrier to getting good care for someone with autism. So what's happening here is something called sensory overstimulation. It's when your brain gets hit with way more information, lights, sounds, touches, than it can possibly process. And when that happens, it can trigger some really intense distress and agitation. And you can see how trying to provide medical care in that state becomes, well, almost impossible. So the big question is, how do we fix this? Well, the really interesting thing is that the solution doesn't start in the ER. It starts way before the patient even gets to the hospital. It's all about being proactive. And that's the whole philosophy in a nutshell, right? Better to anticipate. Instead of just reacting when things go wrong, the goal is to stop the crisis before it even begins. And the number one tool to do that? Simple: anticipation. Okay, so what does anticipation actually look like? Well, first, you've got things like desensitization programs. These are coordinated efforts to help someone get used to a medical environment slowly, in a safe way. Another big one? Visual previews. Seriously, just providing photos and videos of the ER, the equipment, even the staff ahead of time can make a huge difference. It takes away that fear of the unknown. And maybe the most critical piece of the puzzle? A simple alert in the patient's e-health record. It's a quick digital heads up for the staff that says, hey, we need to approach this a little differently.
All right, so with all that prep work done, let's walk through what this new, totally reimagined ER journey looks like from the second a patient walks in the door.
You can see the difference right here, side by side. Look at admission. Instead of a bunch of verbal questions, you're using communication panels, and the family is there the whole time. Then triage and waiting. Forget the crowded, noisy waiting room. We're talking about bypassing it completely for a quiet space. And then in the exam room itself, it's all about consistency, like having one staff member and using visuals to explain everything.
Let's zoom in on the waiting room for a sec, because this is a huge game changer. Think about the usual experience. You're waiting forever, you have no idea for how long, and you're stuck in this loud, bright, chaotic space. The adapted approach just gets rid of that. You're moved immediately to a quiet, low-stimulus area. And they use simple tools, like a visual timer, so you can actually see how much time is left. It's all about giving back a sense of predictability and control. And then, once you're in the exam room, the smart changes just keep coming. And this is where the caregivers really become part of the team. The room is kept super clean and orderly. No extra clutter to cause stress. The patient is actually allowed to touch the medical equipment before it's used, just to make it less scary. They might even simulate a procedure on a caregiver first. Every single one of these steps is designed to do one thing: build trust and dial down the fear. Now, all of these environmental changes are fantastic, but you know what? None of it works without the doctors and nurses. The way they communicate and how they carry themselves, that might just be the most important piece of this whole puzzle. So here's basically the playbook for healthcare staff. It's not rocket science, but it's so important. Use a calm, soft voice. Keep your language simple and direct. Respect their personal space. Don't get too close. And here's a big one. Don't expect or demand eye contact. It's not necessary. And the golden rule through all of this? Prioritize visual communication over just talking. That one shift can make a world of difference. And a really important tool for that is something called AAC. That stands for Augmentative and Alternative Communication. It sounds technical, but it's really just the official name for things like the pictograms and communication boards we've been talking about. And the main takeaway, the thing to remember, is this. In these situations, visual language needs to come first. It should be the primary way to communicate because it offers the most clarity with the least amount of stress. Okay, so let's zoom out and pull all these amazing ideas together. If we wanted to build a truly inclusive ER from the ground up, what are the key principles we need to follow? It really boils down to 4 main pillars. First, anticipation. Preparation isn't just important, it's everything. Second, environment. You don't have to remodel the whole hospital. Simple changes to reduce sensory overload make a huge difference. Third, communication. Keep it visual, keep it calm, keep it clear. And finally, partnership. This is so crucial. Family and caregivers aren't just visitors on the sidelines, they're core members of the care team. And when you think about it, this is so much bigger than just emergency rooms. These ideas, anticipation, controlling the environment, communicating clearly, they can be used pretty much anywhere. So it leaves you with a big question, right? If we can figure out how to do this in one of the most stressful places on Earth, what's stopping us from applying these same lessons everywhere else to build a much more inclusive world?